Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. I'm talking with you from Austin, Texas, where I have permanently relocated now. As many of you know, you've been following me, you know that I've been doing this move and that I've moved here and I'm not doing clinical practice any longer, but I am doubling down on my efforts to do Lyme education to help support people living with the illness as well as physicians and others that are trying to manage people with the illness as well too. And to that end, sometime in July, I will be launching my new online support community for people living with Lyme. I won't be doing it as a Facebook group. Rather, I'll be doing it on a platform called Circle. And that group is called Lyme United. So I'll make you more aware of that as I get there. I'm currently designing the site right now and hope to be able to launch it in July is what we're targeting at this point. Likely after that, within a couple months or a few months after I learn how to work with that platform better, I likely will launch a group to help physicians managing this as well too. So I have not retired. I've just freed up time so I can get more involved in supporting people and educating people on this illness as well too. So I have to apologize. I had a total, I just moved to Austin, 61-year-old brain fart last week, and I missed the webinar we had scheduled. That was my fault. So for those of you that showed up, I was thinking it was supposed to be this week, and I realized after the day after that I had messed it up. So I apologize for that. But I think I'm back on schedule here again. To those of you that are new, welcome. And I'm not usually this messed up in terms of showing up. So I just want to make you aware of that. To those of you that are coming back again, I see a lot of familiar names on my message board. So it's good to have you here as well, too. For those of you that are new, there's a couple ways that you can participate. First, we're going to cover questions that people ask tonight. And you can pay attention to those questions as I read them out loud, and also in the live version, you'll be able to read them on your screen. But the other thing that you can also do is to write a question yourself. Be bold on your first visit. And the way you do that is on the right-hand side of your screen, on the bottom is a chat box. You can write your question to me through that chat box. Now, I want to make you aware of one thing. Every time that you click the enter key, it sends a separate part of your question to me. And that doesn't work well for me. It works best if you just write one long run-on paragraph and get your question in all at once, and don't try to use the enter key to create paragraphs, okay? The other thing I should mention is this forum works best for shorter questions. Those questions where you have to give me a lot of detail about your clinical history, including everything that you've been treated with before, et cetera, it just doesn't work in this format. It's not appropriate for this format. So if we get into some long questions like that, I may decide as I'm reading the question not to take the question. I've been known to do that before. All right. And the other thing I have to warn everyone about too is even though I answer medical questions here, I'm not your physician, okay? I'm answering questions based on the information you give me, but I don't have a full picture of that information. So I urge you to discuss anything I suggest with your physicians and healthcare providers to see if it's right for you as well too, okay? All right. And then one other thing, I am creating a recording of tonight's webinar, and if everything goes as planned, I should have that available for you tomorrow morning. Somewhere between 9 and 9:30 Central Standard Time, which is where I am at this point. And so keep an eye out for that. And in there, you will be able to sign up for the next webinar. I have to let you know I'm going to actually be gone for a couple weeks, though. And so we're only getting 2 webinars in this month. The reason for that is I've got a family wedding I have to attend, and I'll be taking a motorcycle trip to it next week. And then after that, I'm going to be visiting my 92-year-old mom in Indiana, and then taking my motorcycle back down here again. So I'm just not going to be able to do it for a couple of weeks. But after this month, once we get into July, we will be doing at least 3 of these webinars a month. Okay. All right. So without any further ado, let's go ahead and get started. Take the first question here. Let's see. Hello, Lynn. Hi, Dr. Ross. Last time I asked about some mystery symptoms that might be reactivated Lyme, BART, or something else like long COVID, but do not appear to be yeast, by symptoms or questionnaire. You thought treating with cinnamon clove, oregano oil, Japanese knotweed, and cryptolepis while waiting to see if the symptoms persist or become clearer was a reasonable idea. How long would you continue this treatment for? Also, what is the cycling frequency of symptoms I might expect to see if this is Lyme versus Bartonella versus long COVID, which I'm guessing might be more random in its flaring? Okay, so in terms of illnesses that have a cycle, meaning periods of times that they're worse, all right? So the Lyme infection can have cycles of worsening about every 2, 3, or 4 weeks. So Lyme can cycle usually more about 4 weeks. We see that, and we tend to think that's related to the growth cycle of the germ. You get more growth of the germ about every 3 to 4 weeks. And with more germ in you, your immune system reacts more strongly, making more of those inflammation cytokines. And those cytokines are what give you the symptoms. Okay. All right. So in terms of long COVID, I have not seen cycling of symptoms at all with that. And Bartonella generally does not cycle as well either. So if you've got an illness that has some cycling to it, usually that suggests that it's more of a Lyme infection. Okay. All right. Now, in terms of these herbs that you're on, the cinnamon clove, oregano oil, the Japanese knotweed, and the cryptolepis, to go back through that again, the reason I chose that, or I said that might be a good idea, is that regimen of cinnamon clove, oregano oil, Japanese knotweed, and cryptolepis is a regimen that will treat both Lyme and Bartonella, and will treat the growing state of Lyme and the growing state of Bartonella, as well as what is known as the persister state of Bartonella and the persister state of Lyme. All right. So you've picked up all growth states of both germs. And then the cryptolepis, in case there happens to be some Babesia there, would pick that up. So in situations where you're not clear what it is, but it might be tick related, or given your history of having tick-borne illnesses, there's a strong chance it might be tick-borne illness, that's a pretty good regimen to try. Those 3 herbs would handle a lot of different aspects of tick-borne infections. Okay, all right. I can't remember the specific symptoms you shared with us last time. It was a couple of weeks ago, but I thought there was enough there that said maybe Lyme or maybe Bartonella, I believe, that as I recollect. Okay, now, I've said a few things here that I want to explain to everyone. Okay. So I talked earlier about something called cytokines. So for those of you that are new here, that may be a new concept. For those of you that are coming back, you're probably thinking, oh God, there he goes on cytokines again. All right. So let's talk cytokines here real quick. So cytokines are chemicals that are made by your white blood cells when they see an invader, whether that's a toxin, whether that's a COVID virus, whether that is Lyme or tick-borne infections, all right? And they're good. Actually, they're good if they're made in the right amount. So the reason that your immune system makes cytokines is the cytokines are designed to turn on your immune system to fight those infections. It causes more white blood cells to be made and helps draw those white blood cells to where the infection is, okay? So that's good. That's all good stuff, or to where the toxin is, like in a case of mold toxicity illness, okay? The trouble is in certain illnesses, like in long COVID and like in chronic Lyme and like in chronic Bartonella and like in mold toxicity and like in yeast overgrowth in your intestines, the immune system sometimes in trying to get rid of those invaders, it doesn't do a good job, but it keeps trying harder and harder, and it pumps out too many cytokines, okay? So the symptoms of too many cytokines are what we call Lyme symptoms, or what we call long COVID symptoms, are what we call yeast symptoms, or what we call mold toxicity symptoms. And the common symptoms are insomnia, difficulty thinking, body pains, joint pains, weakness, neurologic dysfunction, hormonal dysfunction as well too. So you get all of those are triggered by too many cytokines, basically. Okay, so those illnesses all can look pretty similar. But I believe the last time there was enough there that made me wonder about Lyme or Bartonella for you. And so that regimen could be good. Okay, so then the second thing I discussed here tonight was this idea of growing and persisters. So let's talk about that real quick. So we now know, based on research that came out, gosh, it's probably about 6 years ago for Lyme and maybe a few years ago now for Bartonella, that both Lyme and Bartonella can exist in a growing state, and they can exist in a persister or hibernator state. And it's probably a small percentage of the germs that are hibernating, maybe 10%, according to laboratory experiments. And the trouble is with these hibernators, these persisters, hibernators are persisters, is that they seemed not to respond to the regular antibiotics we traditionally use, okay? So, and then one other thing about terms here while I'm at it. Many of you have heard of Lyme having spirochetes and Lyme having cyst. So those are what the germ looks like, okay? So the Lyme has different appearances. It has a corkscrew-looking thing, okay? That's called spirochete. It's got microscopic round forms, round bodies. That's sometimes what they're called cyst. And then there's another form of Lyme where it loses its covering and it moves inside cells. We call that the L form, okay? Now, the spirochetes and the cyst can be growing or hibernating, okay? So a hibernator persister is not the same as a cyst, okay? The cyst can grow or it can persist. Spirochete can grow or it can be in a hibernator persister form. To be honest, we don't quite know what goes on intracellular Lyme, whether it goes into hibernation or not. We just haven't been able to see inside the cell to be able to determine that, okay? All right. So this regimen, in terms of what works for persisters, most of us that treat Lyme these days are putting people on agents that have some laboratory evidence that they can work against persisters. Herbally, cryptolepis, Japanese knotweed, and liposomal cinnamon, clove, oregano oil are agents that can work against persisters. Interesting, for Lyme, cat's claw, which we traditionally use to treat Lyme, also can treat persisters, according to Hopkins research from over a year ago now. And in terms of pharmaceutical agents, for the Lyme germ, there is disulfiram, but that does not work for Bartonella, all right? And then other prescriptions that might work against persisters would be dapsone, and one of my favorites, methylene blue, which is something that would have to be compounded, okay? So anyhow, there's a lot to discuss about those. I'm not going to go into it right now, but I just wanted to bring up those concepts for you, okay? So for those of you that are interested in more information about persisters and ways you can treat it, let me just oops, I forgot to pull up my screen share. Hold on a minute, I got to get myself set up to do a screen share here. All right, let's see. All right, let me see if I can get my screen share to work here now. All right, I think that's working. Let's see here. All right, so this is my Lyme disease information site, which is Treat Lyme by Marty Ross MD. Essentially, anything I talk about tonight, you probably can see that I wrote an article about it, okay? And in fact, if you have questions, one of the first thing you can do is try to see if I wrote something about it by typing what you're thinking about in the search box right up here. Or the other way I've organized it is most information is on this online Lyme guide tab here. And in terms of persisters, you could look under infection treatment plans. And here's an article I have called How to Treat Persister Lyme and Bartonella, where I review the various ways of doing that. Okay, all right. And then I also mentioned tonight cytokines. If you want more information about how you manage them and how you might lower them as part of your treatment, you can take a look at this article called Control Cytokines, A Guide to Fix Lyme Symptoms and the Immune System. Okay, all right. All right. So thanks for the question, Lynn. Good luck to you. Hello, John. Let's see. In your kills Bartonella treatments, the tier 1 antibiotic options include either methylene blue or liposomal cinnamon clove oregano for persisters. In the tier 2 herbal options, you note that Japanese knotweed is an alternative. Can Japanese knotweed also be used in tier 1? And it is effective, and is it as effective as azithromycin, minocycline, Japanese knotweed, or fluconazole, azithromycin, Japanese knotweed? If yes, should Japanese knotweed be taken with antibiotics or separate? Of your 4 tier 1 treatments, which one do you find most effective? Okay, so everyone, I have an article which John is referring to, which is called Kills Bartonella. Okay, and I've broken my treatments into various tiers, and have suggest tier 1 might be more effective than some of the other tiers. Okay. So let's see what your question is here, though. So let's just go look there real quick here for a minute. And actually, let me read your question here again. I actually need to put my glasses on here for this as well. Let's see. In the tier 1, 2 herbal options, you note, or in the tier 2 herbal options, you note that Japanese knotweed is an alternative. Can Japanese knotweed also be used in tier 1 and it is effective? Yeah. So Japanese knotweed, as I just mentioned, is an agent that can treat persister Bartonella. Okay. Other things that can treat persister Bartonella would be methylene blue as a prescription option. The azoles like fluconazole is an option. Cryptolepis is an option. Or liposomal cinnamon clove oregano is an option. All of those are options when you design a treatment as something that could treat Bartonella, persister Bartonella. They also happen to treat growing Bartonella as well too. Okay, all right. So any of those you could substitute around. Now, in terms of what I call my tier 1 treatments, let's go ahead and look at that together here. Okay, so what John's talking about is my article called Kills Bartonella, A Brief Guide. You can either find that here online, or it is a chapter in my book called Hacking Lyme Disease. Okay, so take a look. Let's see, where do we get into it? Okay, so the tier 1 approaches, I break them down. One of the groups is something called fluconazole-based treatments, okay? And so you would want to do fluconazole. And even though fluconazole can treat persisters, I get added benefit by doing the cinnamon clove oregano along with it, okay? And keep in mind, both fluconazole and the cinnamon clove oregano has the ability to treat growing and persister forms. I like combining it with another prescription antibiotic, which is either azithromycin, clarithromycin, minocycline, or doxycycline. Okay, all right. So those are options. Now, in these fluconazole-based treatments, it is true you could substitute out the cinnamon clove oregano for either Japanese knotweed, or you could even substitute out and put in cryptolepis. I've been known to do that as well too. Okay, all right. All right, and then, so those are the fluconazole-based treatments. There's another group here that I call methylene blue-based treatments. And there's another group I call the macrolide tetracycline-based treatments. Anyhow, you can take a look here at all these. But wherever I have cinnamon clove oregano oil here, you could substitute it for Japanese knotweed or cryptolepis. All right, I do that in my practice, or have done that in my practice before. John, I hope that gives you some insights there. Okay. All right. Good luck to you. Hello, Pat. Hi, Dr. Ross. I'm currently treating Lyme and Candida. My dermatologist told me I have benign lichen planus all over my lower legs and prescribed Eladel cream, which you're not supposed to take if you are immunocompromised. Are Lyme patients immunocompromised? And how do we find out whether or not we are? Alternatively, he says he could prescribe steroid triamcinolone cream. Are you familiar with the condition lichen planus and or those drugs? Do you know what is the safest treatment, or if there's something natural I could try? I tend to be sensitive to many things, and I don't want any new treatment to add more issues to my plate. All right. So everyone that has Lyme is not necessarily immunocompromised. Immunocompromised would mean that you have difficulty handling any infections, that your immune system is compromised either because germs make it so that they can't treat a general group of infections, or you have a deficiency in antibodies and you can't handle infections, or you're on drugs that make you immunocompromised, like being on cancer agents, for instance, can do that, okay? Most people that have Lyme are not broadly immunocompromised, meaning they can handle cold viruses that come in at them. They can handle common bacteria infections that people might get. They can handle virus infections that are out there every season, all right? They don't get compromised by those. And so therefore they are not across the board immunocompromised, all right? It is true though that the Lyme infection, for just the Lyme infection, has the ability to suppress the immune system's ability to deal with Lyme. That doesn't mean across the board all infections, okay? Now, there is a subset of people living with Lyme that do get every virus that comes along, that do have immune suppression resulting in low antibody levels against a broad range of infections, et cetera. And so you would have to talk to your doctor to see, do they think you are broadly immunocompromised, or is it just compromised against Lyme? What I would say is the majority of people are just, their immune system is compromised in terms of dealing with Lyme, but not everything, okay? So in this kind of a situation, if you were my patient and I did not think you were broadly immunocompromised, knowing how you handle regular virus infections, knowing how you handle bacteria infections, knowing that you have normal antibody levels, et cetera, I would say it would be okay to give what's the drug he wanted to use here with you? The Elidela try, okay? I would do that. And I would probably do that over the triamcinolone. Now, triamcinolone is a steroid that can broadly suppress the immune system. And it is true that a small part of that might get absorbed through your skin. And we know that people that are on steroids and have Lyme have a harder time treating the Lyme, okay? But the degree that gets absorbed through the skin is so small that even in those situations, I often will have my patients use triamcinolone if it is recommended to, okay? What I don't agree to do with my Lyme patients is has them take systemic steroids like IV steroids or steroid pills. I don't think that's a good idea for the Lyme infection itself, okay? All right. I hope that answered your question. Good luck to you, Pat. Hello, Douglas. Let's see here. Thank you, Dr. Ross. Love the webinars. Oh, you're welcome. Let's see. I've had BART since age 14. I'm now 53. I just started tetracycline and rifampin and methylene blue with turmeric, berberine, oregano oil, and famotidine. Also on 4.5 milligrams of LDN, also 12.5 milligrams metoprolol for fast heart. My symptoms are body pain, muscle and joint, etc. Lots of neuro. Severe anxiety, almost panic feeling, off balance, disoriented, head pressure, etc. I'm on Tetra because I can't handle Doxy. Plus, I took it 20 years ago for 2 years for Lyme. Along with Biaxin and intramuscular, you took it 2 years ago along with Biaxin and intramuscular shots. My question is, I feel like I'm so gutted from all the years of antibiotics that I want to stop taking antibiotics and go to something more natural, but it has to be strong. What would you honest as I on Cipro for something totally different, and I felt great on it. I don't know if it was a coincidence or if it actually was helping, The Bartonella, again, my concern is all those years I've had it, I've been on antibiotics. It really makes me herx a lot at this point, tetra 3 times a day. Okay. So Douglas, let me make a comment. So the Cipro, which is ciprofloxacin, is in a family of antibiotics which are called the fluoroquinolones. That family also has something called Levaquin in it as well too. I used to use members of that family, however, and people sometimes to get better on it. What we have learned in using those drugs, though, is that there's a risk of developing chronic tendinitis, chronic inflammation of your joints when you tend to use those drugs more long-term. Now, not everyone gets that, but some people do. And I had it happen enough in my practice that I decided this wasn't a good drug for me to give to people unless everything else had failed. Okay. All right. So the other thing to be aware is that there's a very small percent of people that do get that tendinitis that will actually get rupture or breakage of their tendons. So the risk in doing your Cipro or the risk in doing a Levaquin is they may work on the Bartonella, at least on the growing side. I'm not clear that they do anything for persisters, or I'm not aware they do anything for persisters. But you have to they may help kill the germ, but they may not be the best for your tendons and your and you may develop some longer term problems from being on that. Okay, all right. So that would be my comment about Cipro. Yeah, it can be good. It can be a drug that can help, but you run a lot of risk doing it. Okay, all right. So you should talk that over with your doctor. They should be able to discuss the ins and outs of that with you too. Okay, all right. In terms of herbal options, when I get to this point with somebody, so first of all, if you haven't used the methylene blue before, I do see good results with that. So the methylene blue is something that is useful against growing and persister Bartonella. It has good brain penetration as well. All right. And I have had benefit if you want to, and it's not a traditional antibiotic. It's actually something that was designed actually to help a problem that people have called methemoglobinemia. Some people have it, where when they get under stress, their medical stress, that is, their hemoglobin in the middle of their red blood cells doesn't release oxygen. So they become oxygen starved. And the methylene blue can be given intravenously, and its job is to bump the oxygen off of the hemoglobin, basically. Okay. We discovered, though, that it does have antibiotic properties. It seems probably to get into the lining of germs and destabilize them. It probably is not as harmful to the gut microbiome, the germs that live in the gut, the way standard prescription antibiotics would be. It is made into a compounded oral form, so you can take it orally, and orally it's supposed to have good absorption. And it has been a game changer in some of my patients that are not getting better when we use some of the standard drugs. So I like that you're doing that. If you were a patient of mine and you wanted to try something other than standard prescription antibiotics, I have combined that methylene blue before along with a cryptolepis that I mentioned earlier, which is an herb. And I have combined it also with a Japanese knotweed before. Okay, so those are things to keep in mind. The other non-traditional approach I sometimes have tried for my patients with Bartonella would be to do a methylene blue coupled with fluconazole. I mentioned azoles have a good coverage for both growing and persister Bartonella. And I would suspect you probably haven't done a methylene blue fluconazole regimen before. The thing is intriguing about that is it seems to be good for both growing and persister Bartonella as well too. So there's some thoughts for you to take a look at and discuss with your physician. Okay. All right. Good luck to you. Hello, Jamie. Let's see. Dr. Ross, deep appreciation for all your wonderful support. You're welcome. Let's see. Part 1, Babesia in March 2023. I tested positive with Igenics for Babesia fish, Babesia Immunoblot, IgM, negative for Bartonella. My only possible Babesia symptoms are feeling new left leg nerve muscle pain beginning in February 2023. Question 1, even though I have symptoms, Do you recommend I follow your full non-prescription herbal protocol for Babesia, including lipokinase? Any other ideas? When is best to retest? All right, let me just handle that and then we'll move into your part 2 of your question. All right. So, I would need to query you a bit more about that. So you have to keep in mind that I will admit you have a strong test history here that says Babesia, okay? But we have to always be aware that you can have false positive tests. I'll just throw that one out, okay? So I don't treat a test, I treat the person. So if the person has enough symptoms that say they have a Babesia and the test says it's positive, then I'll treat. I'll even treat for Babesia if the person has symptoms of Babesia but doesn't have a positive test, because testing can miss it. We don't really know, maybe 10% of the time or more. Okay, so I treat based on the symptoms. So when you say you have no regular symptoms, the symptoms you've listed here, I would not necessarily call Babesia symptoms. What I call Babesia symptoms are fatigue, air hunger, feeling like you can't get enough air from time to time, having racing or skipping of your heart, getting lightheaded easily on standing, having a lot of frontal headaches, having anxiety or panic attacks. Now, you mentioned, I think, ongoing anxiety. Oh, wait a minute, maybe you did not. So I guess what I would say at this point is I don't know enough about you to make a recommendation. I would need to do a lot more querying of you to find out, do you have any symptoms that really say Babesia to me? And I'm not clear about that at this point. Okay. All right. Sorry about that. All right. So let's see what your second question is here. Part 2. One of the things I want to say, in terms of retesting of Babesia, so I would not retest an Immunoblot, because Immunoblot is measuring your antibody reaction, which your immune system will have a memory and may keep making antibodies even if the germ is gone. Okay. And if the immune system stops making antibodies, it could be that it's too suppressed to make antibodies and it doesn't prove the germ is gone. In terms of a FISH test, that's a microscope exam of your blood using a fluorescent marker that attaches to the genetic material of the germ. And when it is positive, it does have meaning. It means you probably have the germ in you, although there can be false positives still, okay? But when it's negative, it just may mean there wasn't any Babesia swimming by the needle when you drew it. So a negative test doesn't prove that it's gone, all right? So I don't actually support retesting. I go by what the symptoms tell me, okay? All right. All right. Now, if you have a lot of fatigue and that positive Babesia test, sometimes that's all that people have with Babesia is just fatigue. All right. So if you were to have that, yeah, you might consider treating for that. Okay. All right. Let's see. Second question here. Peripheral neuropathy. In 2016, I developed idiopathic non-diabetic peripheral neuropathy, constant sunburn sensation in the legs, forearms. A diagnosis later confirmed by biopsy in November 2021. Very likely this is peripheral damage. Peripheral nerve damage is most likely due to long-term mold exposure of Aspergillus of our home, confirmed by testing in 2021. This mold was removed professionally in 2021, and retesting showed the mold was cleared from our home. Also for my body, the mold has largely been, I think there's a second part of your question wandering around here. Let me see if I can find it. Oh, here we go. Okay, so the mold was professionally in 2021. Also in my body, mold is largely cleared via binders cleansers. Recently confirmed using a Great Plains mycotoxin test. Question 2, mold now removed from both home and body. What can you recommend to regrow and heal my peripheral nerves? FYI, I began in 2022 to take injectable peptides, BPC-157, ARA-290, and now Iprameron. I also in 2022 began these bioregulator peptides, blood vessel, thymus, pineal, thyroid, bone marrow. So far, I still have peripheral nerve damage. Any helpful expert advice, Dr. Ross? So in terms of doing nerve repair, the main peptide that I do like to use is the BPC 157. It's also very useful at doing joint and muscle repair, and it has some laboratory evidence that it can help repair your cell energy factories called mitochondria. Okay, so every one of our cells has these energy factories called mitochondria, and they sometimes can get injured as a result of chronic infection and all the oxidation agents that run around your body. And if they are injured, you're not going to generate enough energy to heal. And the BPC 157 can help with that. All right. Now, you're doing a pretty good regimen here of peptides. The other thing I would consider adding, and really the only peptide I would use here, probably in my practice, I would use is the BPC 157. Now, you should talk that over with your provider. Obviously, they're doing a lot of things for you, but the one that I think has the best track record in my practice is the BPC 157. Okay. All right. So then the other thing that I like to do when people get into neuropathy is I like to try to repair the nerve membrane, and I like to repair the mitochondria membrane as well too. All right. So your nerve cell membrane and your mitochondria membrane is made up of a double layer of fat. They're called phospholipid fats. All right. And they're a mixture of mainly two kinds of phospholipids. One's called phosphatidylserine, another one called phosphatidylcholine. I like to try to rebuild those. And what I like rebuilding those with is an oral phospholipid complex made by a company called Research Nutritionals, which is called ATP 360. Okay. So the main component of ATP 360 is a phospholipid mix that has been shown to get absorbed and to improve mitochondria function as well as brain function as well too. Okay. All right. All right. So that would be to take that 3 pills 1 time a day. In addition, in the ATP 360, there are a number of micronutrients that help the mitochondria work better. So think of that. Think of the ATP 360 as repairing the cell covering and the mitochondria membrane from the outside. Keep in mind, once your nerves are injured and your mitochondria are injured, they will exhaust the reparative chemical found in every one of our cells and mitochondria, in a limited degree mitochondria, and that's called glutathione. And glutathione's job is a very powerful antioxidant, and its job is to fix injury within mitochondria and within nerve membranes and within every cell. All right. So if your cells or mitochondria are injured, they will exhaust the mitochondria gas tank. All right. So you need to fill it back up. And so what I like using for that is oral glutathione. And but when you do oral glutathione, you got to be careful that you use something that's been shown to absorb. Regular glutathione can be destroyed in the stomach. So you need a liposomal glutathione. And the company that and so liposomal means it's glutathione microscopically wrapped in fat. Okay. And the product I like for that is a Research Nutritionals product called Tri-Fortify. There is an orange flavor and a watermelon flavor. They've got good data showing that when people take it, they get marked elevations of glutathione within their red blood cells. That's the cell they use. They didn't measure in every cell, but it gets absorbed. Okay. And when I've got someone with severe neuropathy, what I'm often going to do is to have them take a teaspoon of that twice a day, which is about 500 milligrams of glutathione twice a day. Okay. All right. So some things to consider adding to BPC 157. I'm not so sure about the other peptides you're using, but the BP 157 for sure. I would add ATP 360, and I would also add the glutathione. All right. So, talk it over with your provider and see what they think. But those are some things I would find helpful in my practice. Okay. All right. Good luck to you. I'm going to do a quick screen share here because I know people may have some questions about a few things here. So let me just do this. All right. So everyone that may not be familiar with peptides, I'm just going to show you an article that you can read about this. So peptides are short strands of amino acids that are less than 40. Anything over 40 amino acids is called a protein. Okay. All right. So our body makes we've classified nearly 100 different peptides that the body makes, and each of these peptides have different functions. There are a variety of these that are available orally, and they each have different things that they do. So if you want to read about peptides and the oral ones that are available and what they might help with, take a look at this article here where I talk about peptides. Okay. Right. And then in terms of these products I was talking with you about, they're both research nutritionals products. And so actually, I'm just going to look under the research nutritionals tab here. All right. And so one of those was ATP 360. This is the phospholipid complex one I was telling you about. Okay. And then the other one was the glutathione. And this is one of them. This is the Tri-Fortify orange product that I was telling you about too. Okay. So everyone, this is my store, Marty Ross MD Supplements. Many of you are familiar with it. If you ever want to know what glutathione I recommend or what curcumin I recommend to lower cytokines, is go in, type it in the search bar, click it, and see what products show up. And if you know I'm using it, and these are products I have used with my patients in Seattle and found good success, you know you found a good product, okay? And you can also order these from me as well too. I ship to anywhere in the US and in Canada. There's also an international shipping option for people outside the US. And if you are in the US, we offer free shipping on orders under $50 or over $50. And I cover your state taxes and local taxes as well too, okay? All right. All right. Thanks for those questions, Jamie. Good luck to you. Hello, Yanni. Let's see. Hi, Dr. Ross. Much gratitude for all your excellent support. You're welcome. I recently found out through IGeneX testing that I have Babesia and Bartonella. In addition to the herbal protocols that you recommend, I have been advised that EBO ozone dialysis treatments are very efficacious. What is your opinion? If they are helpful, how many should I do? Regarding your Babesia protocol, is it okay to start both the crypto and the artemisinin, or should I just do cryptolepis first and wait 2 months to do the artemisinin? All right. So for my Babesia herbal protocol, you could either do crypto by itself or you could add artemisinin. You don't have to start. Probably the stronger approach would be to do both cryptolepis and artemisinin together. Okay. For those of you that want to see the recommendations on that, the article at my Treat Lyme by Marty Ross MD website is called Kills Babesia, a Brief Guide. That is also available in my book. So this is my book, Hacking Lyme Disease. Actually, this is a pre-publication one, which is why it's got that gray band on it. But this is my book, Hacking Lyme Disease. I should stop blocking the light here. And this is available for sale at my store, or you can find it on Amazon as well too. Okay, it's a compilation of about 40 key articles from my Treat Lyme by Marty Ross MD, and in there is the article called Kills Babesia, a Brief Guide. Or again, you can find it at my site. The reason I wrote a book is, or republished these in a book, is some people wanted a book format. But as many of you know, I also have those available for free on my site as well too. Okay, all right. So, and then in terms of ozone, I am not a proponent of ozone, and let me explain why. So what I would say is a lot of my colleagues haven't done their homework. I'll just start by saying that, okay? It is true. If you take a test tube full of germs and you put ozone into that test tube, it'll kill all the germs. That's true, all right? And so many of my colleagues stop there, and they don't investigate further, and they think, oh gosh, if it works in a test tube, it must work in a human. But that probably is not so. So what happens when you take a test tube, then you put all the germs in, and you take a minor amount of blood and you put it in that test tube, then you put the ozone in, no killing at all. Absolutely no killing at all. And so what happens is ozone and hydrogen peroxide and UVA, UVB treatments of blood, those are all oxidation treatments. They are either oxidation agents themselves or they create oxidation agents. And the oxidation agents can kill germs by damaging the membrane of the germs and damaging the DNA of the germs, okay? But the problem is, in terms of getting that ozone into you in a way that it can kill, is it has to get into the blood. And guess what your blood is loaded with? Your blood is full of antioxidants, okay? Full of them. And so those antioxidants neutralize the killing effect of the ozone, all right? That's what that other experiment tells us, where you take a test tube full of germs and you put a drop of blood in, and then you put the ozone in, no killing, okay? Now, I admit there are a number of people that feel better when they get their ozone treatments and their hydrogen peroxide treatments. And there's reasons for that. If you look at the science on it, the science suggests what happens when you do an ozone or you do a hydrogen peroxide is that it results in better oxygen delivery to your cell energy factories called mitochondria. And with that energy boost you get, you feel better, all right? But in terms of it being a good killer and being something that is sustainable, I have not seen that. I don't support these as ways of treating your germs. I would support them maybe as a way of helping your mitochondria work better, but I would limit, I have advised in my practice always to limit treatments to 8 or less. The reason is, keep in mind, you're dumping oxidation agents into you. And if you think about it, what are the big things that we do in anti-aging medicines besides hormone therapies? We put people on tons of antioxidants to reverse the damage of oxidizing agents. So you don't want to put a bunch of oxidation agents in you, because you may be leading to greater problems for your body and your cell function down the road. All right. That's my opinion on that. Okay. All right. Good luck to you, Yanni. Oh, Yanni, if you want to see some more information, including the science that I was just quoting here, yes, I've written an article about this. Let's see here. All right, so take a look at my store. If you just go to this, or my information site, type ozone in the search bar here. All right. And here's the article: ozone, hydrogen peroxide, vitamin C, UV blood irradiation, and Lyme. And I review why I don't support these as agents that are effective, okay? In fact, it's interesting is there's a group in California called My Lyme Data that has asked people what it is they did that got them better. And one of the things they asked them was about various alternative treatments. The My Lyme Data said that about 39% of people did report some improvements. 20% found it very effective, 19% moderately effective. But what I would say to you is a placebo, if we gave you a sugar pill and you were a part of an experiment where some people got the sugar pill and some people didn't, there's a 30 to 40% chance if you took the sugar pill, you would feel better. Okay, so maybe some of the effect of this ozone is placebo effect. And then the other thing, as I was suggesting, is it may help your mitochondria work better as well too. Okay. All right. Thanks for that question. Hello, Colleen. Let's see, Dr. Ross. Is Easy Tea safe? In addition to my Lyme issues, I have precancerous cells on my chest, which are okay now, but the doctor says to keep an eye on it. I consider taking Easy Tea for its health benefits, just as a shot in the dark precaution. Your thoughts? P.S. Thank you for these webinars. You know, I'm not familiar with Easy Tea, so I can't make a comment on that. I'll have to look into that a little bit. Thanks for the question. Good luck. Hello, Gail. Hi, Dr. Ross. Let's see. Hold on here. I gotta get some water in here. Hi, Dr. Ross. Let's see. I tested 2 weeks apart with Great Plains in real-time labs. For both, I did glutathione 2 times per day and took a hot bath before collecting. Great Plains shows high levels of aflatoxin, ochratoxin, and insanely high levels of zearalenone. Real-time labs shows no aflatoxin or ochratoxin and trichocethene of 0.213, and then you provide the range. Gliotoxin of 1.74 and zearalenone of 1.9. Which result is accurate? Great Plains Labs or real-time lab? Can Great Plains have false positive or real-time labs false negatives? I'm so confused and at a loss what to do with these very contradictory results. Also, my Lyme litter naturopathic doctor uses glucomonin as a binder. Is that safe and good to use? Glucomonin. I'm not familiar with that one. I'd have to actually, let me just do a quick search and see if I can find out what that is. Just a minute here. Glucomonin. What I would say is it's a fiber, and so it may have binding potential. I just don't know it. I haven't worked with it before. Okay. All right. In terms of why these labs can have different results, they have different testing techniques. All right. Real-time labs uses an ELISA immune antibody detection method, and the Great Plains uses something called gas chromatography. And so they can come out with different results. They're both detecting these differently. I know Neil Nathan, who many of you may be aware of as one of the leading, probably the expert on mold toxicity illness, believes that Great Plains is probably the more accurate lab, but actually designs his treatments based on the input of both of those labs because of the different techniques that they use. And if you look collectively at and so one thing for sure that he would say, and I'd say too, is that Great Plains is, or Real Times is probably better for black mold toxin. I think it's a better test. I also think it's a better test for gliotoxin as well too. Okay. And Real Time is all right. But you can put both of them together. And if you put them both together, it says you still have toxins. You probably have more work to do basically. Okay. All right. Good luck to you, Gail. Thanks for the question. Hello, Maria. Let's see. Dr. Ross, thank you very much for the advice and help. I appreciate it very much. You're welcome. My questions. 1, taking probiotics during gut cleanup using natural remedies of oils and herbs. I'm aware of at least 2-hour interval between antibiotics and probiotics. But will the good bacteria still be killed along with bad ones? And what good will it do then? Isn't it better to finish the treatment, then take the probiotics to rebuild the gut? 2, gut disbalance and cough. Could you please explain the mechanisms? The chronic cough comes mostly while speaking and never otherwise. It's a mystery to me. X-ray is done normal. 3, Klebsiella pneumoniae. Is it possible to get rid of it with herbs? Would you have any advice as to which ones? All right, I'll try to take these in order. So number 1, where's number 1? In terms of probiotics, it is true you're kind of treading water to a degree if you are taking antimicrobials and taking your probiotics at the same time. That being said, taking probiotics, you still get some of them that will establish, And taking spore-forming probiotics, for instance, actually supports existing bacteria in the gut to work better and to function better as well too. So it is true that you're not going to really fully rebuild your gut until after you're off antimicrobials. There still is benefit though in taking them, as long as you can separate them from your antibiotics or your anti-probiotics. Okay, all right. All right, number 2, gut disbalance and cough. I can give you a mechanism to think about, but you'll probably need to talk with your doctor about that, okay? So one of the things that can happen if you get dysbiosis in the gut, especially if you have too many yeast in the gut, that can trigger dysbiosis. Means an abnormal balance of good bacteria and yeast in the intestines, okay? So if you get dysbiosis that involves yeast, those yeast will trigger activation of your mast cells that line the intestines. And mast cells that line intestines are the cells in your body that make histamines, all right? So you can release those histamines and they will go upstream up to the lungs and they will go to the nose. Now, 2 mechanisms that they sometimes can do then related to coughing is if you get excess histamines at the level of the lungs, they sometimes trigger an asthma-like reaction, okay? If you get too many, and that can lead to coughing. If you get too many histamines up here, sometimes they'll cause postnasal drip, and that drip going down the back of your throat, you have to clear your throat from that as well too, all right? I have found when I have patients, especially with yeast dysbiosis or yeast intestinal overgrowth, if they have a history of asthma, especially asthma, that if you treat the yeast, you can get rid of their asthma. I had a patient that had years of just terrible asthma. And as we cleared her intestinal yeast overgrowth, her asthma completely resolved. Okay, so it's possible, right? So talk to your provider, see if they think you have postnasal drip. If you do, that could be because you're activating the mast cells in the gut due to dysbiosis, especially if it's yeast, and see if they think you might have asthma. They should be able to do a breathing test in the office to see if you might have that as a possibility. Okay, all right. Let's see. Number 3, Klebsiella pneumoniae. Is it possible to get rid of? Yeah, I think you can get rid of that if you have abnormal amounts of it. And generally, herbally, if I've got a bacterial dysbiosis, the herb compound I like using is a biocidin drops. That mix of herbs that's in biocidin and doing it in the drop form seems to work fairly well. A regimen I have used before with my patients would be 1 dropper full 3 times a day. And I usually do that for a couple months at least. Okay. All right. Good luck to you, Maria. Hello, Susan. Thanks so much for your valuable insight. Can you discuss Crentoffel for Babesia decani? I hear it's a game changer. Can't get it though. Back order till July. Implications for hemolytic anemia. All right. So there is a class of antimicrobials called the quinolines. All right. And one of those is the drug Crentoffel, also known as tefenaquine. And there's another one called primaquine. All right. It can be a very good drug for treating Babesia in general, whether it's Babesia decani, Babesia microti, or Babesia oticoli, or other strains of Babesia. The difficulty with it is getting it. It has been in constant back order, now is on a very long-term back order. As an alternative to using it, you could try to use primaquine instead and substitute it for the Crentoffel. But in my my article called Kills Babesia Brief Guide, I list out the quinolines as being a quinoline-based treatment as being a tier 1 approach. And in that, you can use either tefenaquine or the primaquine. I know that Dr. Lindner is one of the newer doctors in this space that talks a lot about Babesia management based on experience managing his own daughter, actually. He's a big proponent of the tefenaquine. Frankly, I think both have a reasonable chance of helping a person, okay? Yeah. So if you want to read more about it, let me just show you my article and what I have been doing with my patients that that have been on tefenaquine crintofol during this outage, if you will. I've been having them do the primaquine instead as an alternative to that. Okay. So let me show you my article here. All right, so take a look on my infection treatment plan section here and take a look at the article called Kills Babesia, Brief Guide. And then you're going to see that I basically have two major tier 1 categories. One would be atovaquone-based treatments. These atovaquone would be things like Malarone or Mepron, or quinoline-based treatments, being primaquine or tefenaquine, okay? And I list out what you would want to combine these agents with here. All right. And apparently I have a friend of mine who's trying to FaceTime me right now. He knows I'm in webinar, so anyhow, I hope he stops ringing me there. I'm sorry about that, everyone. Let me see if I can kill FaceTime here so it doesn't show up again. Well, we'll see. Anyhow, let's see here. Let me go back here. Anyhow, there you go. So take a look at that Kills Babesia guide where I talk with you about how to use that primaquine as well too. Okay. And good luck to you. Hello, Anna. Hello, Marty. After a long absence from antibiotics due to stomach problems, my doctor is offering custom-made glycerin tincture containing Japanese knotweed, cat's claw, scutellaria, black walnut, and cryptolepis. Will these herbs address all forms and stages of Borrelia, Babesia, and Bartonella? Is this a good combination? Would you add any other medications or herbals? What are the corresponding tinctures products in your store that contain these herbs? Thanks, Anna. All right. So they want to use the Japanese knotweed, cat's claw, scutellaria, black walnut, and crypto. All right. So the knotweed, cat's claw, and scutellaria, and the black walnut, the Julian's nigran, and crypto, all of those will address Lyme. The knotweed, I'm just thinking what the science says. The knotweed and the cryptolepis will address Bartonella. And then your Babesia is covered here by the cryptolepis. If I were to make this stronger on the Babesia side, I would also add in artemisinin, okay? I generally don't like doing combination products. The reason I don't tend to do that in my practice is that if something goes haywire, you have a hard time figuring out what it is that went wrong exactly. Okay. So generally in my practice, I don't do combinations. I do have individual products in my store for Japanese knotweed, cat's claw, and the crypto. I haven't been using the black walnut specifically, and I haven't been using scutellaria specifically either. Okay. All right. Good luck to you, Anna. Hello, Valerie. Let's see. For 8 months, my son has been taking choline 3 to 4 times a week with a sauna for mold. We forgot to keep all his Bartonella probiotics, antibiotics, herbs, and supplements 2 hours away from the phosphatidylcholine. How much do you think this may cause of his feeling worse? I'm not aware they necessarily need to be separated. So you may want to talk to your provider and see why they suggested that, but I'm not aware they need to be separated. Okay. All right. Thanks for that question. Hello, Carter. Can people sweat out toxins? So toxins, when we talk about detox, we're talking about water-based toxins or we're talking about fat-based toxins, okay? Water-based toxins are what your kidneys get rid of. They filter your blood for water-based toxins. Fat-based toxins are generally cleared out by the liver, but they also could be sweated out. If we look at studies done about the effects of sauna, heating the body up, when you heat a person up, that does cause them to sweat. And what the heating also does is it helps mobilize toxins out of your tissues into the bloodstream. Once those toxins get into the bloodstream, about 90% will be cleared out by the liver and about 10% will be sweated out. All right. So just keep that in mind. Your major way of getting your fat-based toxins out is through the liver removing them, but you can get some help removing them by sweating too. Okay. All right. Hello, Mary. Hi, Dr. Ross. How long do you need to stay on liposomal cinnamon, clove, oregano? Can it produce bad Herx reactions? Thank you. So, in terms of staying on it, again, the reason that you want to use it is as your agent to treat persisters. All right. It can also break down biofilms as well, too. I will use it 6 months to a year at a time in my practice. If I decide to stop it, I'm usually going to substitute in either a cryptolepis or a Japanese knotweed would be some alternatives. Okay. All right. And does it produce Herx reactions? Yeah, it can. In terms of severity, it depends on the person. There's some people that do get strong reactions to it, and there's other people that don't. If you are concerned, you would want to start at 1 a day rather than trying to start at 1 pill twice a day. Okay. All right. Good luck to you, Mary. Hello, Cesar. Let's see. Hi, Dr. Ross. Daughter has Bartonella and psychiatric symptoms. Been on doxy, diflucan. Hold on here a minute. Let's see. Daughter has Bartonella with psychiatric symptoms. Been on doxy, diflucan, plus cinnamon, clove, oregano for 2 months. 80% better. Doctor wants to change after 3 months to methylene blue and azithromycin. Do you usually alternate the antibiotics after a while if they are working? 2, if after 4 months symptoms are gone, do you stop treatment cold turkey or do you reduce doses or herbs? And 3, my doc is starting slowly herbs with antibiotics with the MC Bart 1. Do you usually do antibiotics and herbs together? And 4, after stopping antibiotics, what are the herbs you recommend to keep the treatment and for how long? All right. So, in my practice is if a regimen is working, I don't change it. All right. I will make changes at about 6 months because then I do start getting concerned about resistance developing, the germs developing some resistance to the agents. But generally, if you're on a treatment regimen that has worked and is still moving a person forward, I don't make a change at 3 months. Having said that, a methylene blue azithromycin regimen would be a strong regimen. I think it has a good chance of being an effective regimen. Okay. And what I usually will do is I treat my BART until symptoms are resolved for at least a month or 2 before I stop. And then I usually will stop all antibiotics cold turkey. You can do herbal antibiotics and prescription antibiotics together. I have no problem doing that. And then I don't always leave people on herbal antibiotics after I clear the germs. It's possible to cure these things, okay? Now, if you're a person that has treated BART before or you have a child that's had their Bartonella treatment before and they relapse, then I might consider leaving them on some herbal antibiotics to police the environment after the prescriptions are done. But it isn't something I do routinely because I do think that you can cure these illnesses. Okay. So anyhow, those are my thoughts on that. Okay. Good luck to you. Good luck to your daughter. Hello, Lou. Let's see. Can you still do herbal treatment for Lyme if you have mast cell activation and can't use tinctures with alcohol? You can. The thing you would need to look into is possibly pill forms, although they're harder to find. But pill forms often can be things you can do. I know Buhner, as in Buhner Herbs, has passed away. I'm not sure if his website and answers that he has given before, but usually in his websites, and you may want to Google and just see, he would recommend various sources for the pill forms. I just haven't done that in my practice. I tend to use more of the herbs, the liquid tinctures, that is. Okay. All right. Thanks for the question. Hello, Bill. Hi, Dr. Ross. How long do you give the LDN before you think it is not going to help? If it does help, do you advise to stay on it forever? If you are taking it long term, can you develop independency from the increased endorphins produced? Thank you. So, it's interesting. I used to, when I first started working, so low dose LDN, everyone, is low dose naltrexone. Naltrexone is a narcotic blocker, an endorphin receptor blocker. It is used to help with alcoholics to manage their illness. And it can sometimes be used in alcoholics. It's also used with people with drug overdose issues as well, too. It is at low doses is an immune system modulator. Okay. Now, I have used it when I first started using low dose naltrexone. I would give it about a 2-month to 3-month try with people. And if I didn't see benefit with it during that time period, I would stop it. Okay. Subsequently, though, I went to a conference just on low dose naltrexone, and the general opinion of most of the experts there was to give things a 6-month try. And so when I did come back from that workshop, I did start using it for 6 months at a time. Okay. And what I have to say is I think you need to give it at least a 6-month try. Once you determine it is helping, I like people to stay on it for about 6 months to a year, and then I'll try to stop it and see if they still need to be on it anymore. Okay. All right. Good luck to you, Bill. Hello, Susan. Let's see. My daughter has hemolytic anemia, likely infection driven. She has so many and all contribute to anemia. Something do the meds to treat. What can she do? Feels terrible for the last month. Axi can't find a safe mold-free. Oh, Axi. See, Axi do the meds to treat. Axi can't find a safe mold-free environment. What advice do you have? I'm not sure what to advise you here because I'm not clear. I understand what your question is here too, so I apologize for that. Hello, Carter. Let's see. Does Bartonella cause muscle soreness and weakness, or is that Lyme? I tend to think of that more as a Lyme-related issue. Bartonella can give a more joint pain, just like Lyme can, but I tend not to see the muscle soreness and the weakness with it. Okay. Hello, Laura. Should probiotics be taken away from antibiotics? My daughter, who has Lyme, Bart, Bab, and alpha-gal since 2001, has read conflicting info. Also, what do you recommend about timing of mold binders in relation to antibiotics, probiotics, and supplements to reduce inflammation? Thank you hugely for all your long-term and ongoing support. So prebiotics, again, are items you take that support healthy bacteria. They are not living organisms per se. So you could take those at the same time as the antibiotics, okay? And then in terms of binders, again, they're called binders, right? So we worry about them binding up things that especially are fat soluble, but just binding things in general. So a good rule of thumb that I tell my patients is to stop all their medicines and supplements beginning 30 minutes before they take their binder, and then they can resume taking their medicines and supplements 2 hours after they take their binder. Okay? All right. Thanks for that question, Laura. Good luck. Hi, Christine. Let's see. Gee, I hope you're okay. Worried about you last week. Missed you. Yeah. I think I addressed that earlier. That was my mistake. I haven't gotten into my regular routine here, and I botched up and didn't show up for my own webinar last week. So I apologize for that. Hello, Douglas. Let's see. Basically, I've been gutted for 2 years of doxy 20 years ago. I need strong herbal protocol. I may stop all antibiotics as causing me stomach issues. Douglas, I see where you've written me. For some reason, your whole question is not coming through. And I know you said something to me about being frustrated with my platform. Let me just look one other thing here too. Douglas, I'm not clear why you're not being able to get a complete question through to me. I'll just say that too, okay? So, oh, now I see a lot of things. I think what's going to be better for you to do is I'd like you to go ahead and write me directly. And this is for Douglas only, everyone, not everyone else on the forum tonight, all right? Douglas, send a full question to me to Doc Marty, that's DOCMARTY, at martyrossmd.com. So that's at MARTYROSS, the letter M, the letter D.com. And hopefully I'll be able to get an answer back to you. Okay? All right. Hello, Carol. I have 33 years of Borrelia, Bartonella, Babesia with severe numbness of my feet. Make me huge fall risk. I surely want to get at persistent cells. Also have partial seizure disorder. I'm afraid to try disulfiram. Any and other suggestions for them? Thanks. So, if you've already got severe neuropathy and seizure disorder, if you were my patient, I would not put you on disulfiram. There's great risk of further neuropathy, and there's great risk of neurologic problems developing on the disulfiram. All right, so I would just say that to you. That is not a risk I would take with a patient of mine. Other options to look at to treat for persisters, again, take a look at the article. I showed you that earlier tonight. You could look at things like dapsone. You could look at things of methylene blue-based treatments. You could look at things like cryptolepis, Japanese knotweed, liposomal cinnamon, clove, oregano. There's a variety of ways that you can go at it that do not involve using disulfiram. Okay? All right. Good luck to you, Carol. Hello, Joe. Hello, Dr. Ross. My son was diagnosed with metastatic adrenal cancer 11 years ago. At the same time, he tested positive through commercial labs with Lyme, Rocky Mountain spotted fever, and Babesia. I think he may have mold toxicity, which we will soon be tested for, and will also be tested for metal toxicity and retreated this time through igenic, or retested this time through igenics for Lyme and Babesia again. Why his LMD wants to retest for only those, I don't know. My question is, what should he be tested for in the igenics panel? And should we wait until we figure out the mold and metal toxicity? He is in a lot of pain from Lyme and co-infections. I want to help him. Thank you. Let me just read back through this again. So I would need to know a lot more about his symptoms just to answer your question about what should be or should not be tested for at this time. So I'm sorry, in this kind of a forum, I can't do a give and take question and going back and forth with you, question and answering to help figure that out. Okay. So I can't answer that one for you. And then in terms of timing of things, what I have found, I'll just make an observation for you. It is possible that when somebody has tested positive for Lyme and tick-borne illnesses, that if they actually have mold toxicity, it may be that their problem is mold toxicity and not the tick-borne illnesses. All right. So if your son has been treated for tick-borne illnesses and still is very sick, that raises the possibility there may be another problem going on. And that other problem might be mold toxicity. So, and again, as I mentioned earlier tonight at the beginning of the webinar, they can look the same, right? So, especially if he's been treated for tick-borne illnesses and remains sick, I would be looking at mold toxicity. I would consider, and again, I don't know all of your story. There may be a rationale for why your doctor is doing this. I would consider the mold toxicity. Okay. All right. Good luck to you, Joe. Good luck to your son. Hello, Christine. Hi, Dr. Ross. I listened to the podcast on Tick Boot Camp, and I got excited to hear about your webinars. I was interviewed on Tick Boot Camp as well. But the question I have for you is, how does someone like me, who has spent all of their savings towards getting treatment over several years, how do they treat themselves? I can't hold a job. I no longer have a place to live. I get my food from the food bank. And I have been looking into the possibility of going to a shelter. Also, when I was being treated by GemSec, he said he believed I have gone at least 20 years undiagnosed. So, Christina, you're in a tough position. I don't have a great answer for you. It sounds like you probably would not be able to afford seeing a Lyme literate physician or a healthcare provider. You might take a look at my Ross Lyme support protocol as a place to start. But treating yourself is complicated, as you know. And even being able to afford the herbal antibiotics is very difficult as well, too. So I don't have a good answer for you, unfortunately. But if you are left treating on your own, take a look at a lot of my information. I give a lot of good information that can help guide you along that path. Okay. All right. Good luck to you. Hello, Linda. Daughter, young adult, sick for many years, psych symptoms, diagnosed with Bartonella-induced PANS and Babesia and Borrelia. On Celebrex, H2 absorb, acetylglutathione, histoquel, antihistamine. One very sensitive to meds. What would you start to treat tick-borne diseases? Bear with me. I'm just looking back through what she's on here. So, boy, this is tough. I'm just saying it's tough because it's hard for me to give a response, knowing that she's so sensitive. Even when I interview somebody and work with them over months, it can be very difficult to pick and choose what is the right thing to start to go with. So I'm not going to have an answer for you here because I need to know a lot more about her sensitivities, how she reacts to different things, what she has tried before, what kind of doses she's tried before. And so I really can't say. All right. Good luck. I would see if you can, and I hope you can do this, but if you could find somebody that's Lyme literate, it would be really useful for you. Okay. All right. Good luck. Hello, Barb. Let's see. Can Bartonella become resistant to tetracycline and rifampin? I've been on both for years and we have pulsed other things. I feel like they are not working as well to hold symptoms back, but I'm unable to tolerate doxy or minnow. I also cannot take rifabutin. So Barb, yeah, your germs can become resistant to the tetracyclines. You might take a look at my article called Kills Bartonella Brief Guide. In there, take a look at what I would call the fluconazole based treatments. Where you could combine fluconazole, which we historically used to treat yeast, but the azole family, that's fluconazole is a part of a family called the azoles. There was research done out of Johns Hopkins University a number of years ago where they took a member of each major drug family, like doxycycline for the tetracyclines, and they used a drug called clotrimazole, an azole, to see if the azole family would have effect against Bartonella. And so they determined that it would. The trouble with clotrimazole is it's only available as a cream. so none of us were doing anything about that. But I started thinking about a year and a half ago, wow, I wonder if azoles in general, the family might work against Bartonella. So there's no research showing that fluconazole works, but based on the fact that an azole like clotrimazole can work, based on that study out of Hopkins, I started using fluconazole in my treatments and have been finding very, very good benefit from doing so. All right. So you may take a look at one of the fluconazole-based treatments. You can combine that with an azithromycin. You could combine that with a clarithromycin, and you might get some benefit doing that as well too. Okay. All right. Good luck to you. And yeah, take a look. You'll see my article. I showed you earlier tonight, the Kills Bartonella article. You may want to bring that to your physician or your healthcare provider, see if they can help you with that. Okay. All right. Good luck. All right, everyone. That's it. That's an hour and a half for me tonight. So listen, it's been good being with you here tonight. Again, I'm sorry I missed last week. That was on me. I apologize for that. I am going to be gone attending family events the next 2 weeks, traveling on my motorcycle from Austin, going to Milwaukee, and eventually to Fort Wayne, Indiana, and then traveling back down here again. Because I'm going to be visiting family, I'm not going to be able to do my webinars the next 2 weeks. Once I get back, though, we will get back into a regular regimen of doing those webinars. And so in tomorrow morning's email, though, you will be able to sign up for the next webinar, which will be at the end of June, towards the end of June. Take a look at that link tomorrow morning, and you can sign up for the one that's going to be 3 weeks from now, I guess, is when it's going to be. Anyhow, so it's been good being with you here tonight. Keep an eye out on your email tomorrow morning when I send out notice that the recording is ready. That should be between around 9 to 9:30, by 9 to 9:30 a.m. Central Standard Time. All right. Good night, everyone, and good luck to you.